Hi, good afternoon, everybody. This is Ramina Zarm, owner and operator of Flex to Success Clinical Rehabilitation Services. And this week I'm doing a video on excoriation. Last week I did a video on trichotillomania. Excoriation falls under the umbrella of the OCD illnesses. I said I would do every OCD illness. This is the next one on the list, so without further ado, let's jump right into it. Excoriation is referred to as chronic skin picking. It's also referred to as dermatillomania, and it's a mental illness that involves repeatedly picking at one's own skin, which results in skin lesions and causes significant disruptions in daily living. So what is the diagnostic criteria in order to be diagnosed with excoriation? Well, the first one is recurrent skin picking results in skin lesions. So lesions are like little marks on the skin that will happen because usually when people engage in chronic skin picking, they use their fingernails to break open the skin and pull pieces of the skin off of their face, their arms, their legs. Those are the most common places where people engage in chronic skin picking, and that's how the lesions are formed. The second criteria is repeated attempts to decrease or stop skin picking have failed. So if people are engaging in chronic skin picking and constantly trying to stop and unable to, that's a surefire sign that you should be diagnosed with chronic skin picking. If you went to a specialist, they would definitely look into that diagnosis and keep it as something to rule out. The next one is the skin picking causes clinically significant distress or impairment in social or occupational functioning, as well as other important areas of functioning, such as completing ADLs or activities of daily living. It's very common for people with chronic skin picking to stand in front of a mirror for hours on a daily basis and just pick at their skin, kind of like in a trance-like state. Different things can run through your mind while this is going on. You could be thinking of past traumas. There is usually a trigger that causes someone to engage in chronic skin picking. If you look at some of the studies that have been done on excoriation, you'll see that people who have this disorder or who have been diagnosed with disorder have elevated stress levels. So there is a correlation between the amount of stress you have and the amount of chronic skin picking you engage in if you're diagnosed with this particular illness. The next criteria is skin picking is not attributable to any medical condition or substance use disorder, such as scabies or cocaine use. So real quick, when you have scabies, it creates like an itch sensation. A lot of times people will pick at their skin trying to get to the scabies. So if that's the case, you wouldn't be appropriate to diagnose somebody with chronic skin picking in that scenario. Also, when people are coming off of cocaine use, a lot of times they will feel skin nerve sensations under their skin, and sometimes people will pick at their skin repeatedly to try and alleviate that sensation that they're feeling, that itch, that feeling like things are crawling underneath their skin. And sometimes they'll break the skin. So you don't want to diagnose somebody with chronic skin picking or excoriation when they're coming off a drug like cocaine. The last criteria is the skin picking is not attributable to another mental illness. So what do they mean by that? Well, if you have a psychotic disorder and you're experiencing tactile hallucinations, you might pick at your skin because you might think that there are something crawling under your skin, or you might think that there's a device inside of your skin like a microchip that you want to pick at your skin to get to take it out. That would not be an appropriate diagnosis for excoriation. If you were experiencing something like that, you would be better off getting treated for your psychotic disorder or psychotic illness. Aside from tactile hallucinations, there is also self-injury involved with borderline personality disorder. So if somebody is injuring their skin, either through cutting, slicing, or just, digging in with their nails into their skin because of a borderline personality disorder, you would want to treat the personality disorder and not diagnose the person with excoriation. So those are the criteria, and that's how it's defined. The treatments for excoriation are as follows. So SSRIs seem to work the best based on the random trial studies that have been conducted on excoriation. Celexa or citalopram is an SSRI, and fluoxetine, also known as Prozac, is an SSRI. Those have been known to work the best. They're also used to treat depression as well as obsessive compulsive disorder. And SSRIs are selective serotonin reuptake inhibitors. What they do is that they don't allow all the serotonin to escape out of the cell once it's being reuptaked back through the body. And that allows the person to maintain some, those happy feelings from the serotonin for a little bit longer, and usually works to reduce chronic skin picking as well as other obsessive compulsions that someone might engage in who is diagnosed with either obsessive compulsive disorder or excoriation. Different talk therapies that work well. From the research, it states that CBT and ACT are the two best talk therapies to assist with this. CBT and ACT are pretty similar. ACT stands for acceptance and commitment therapy, and CBT stands for cognitive behavioral therapy. The difference between the two, so ACT teaches people to embrace and accept the fact that they're going to have these urges and compulsions for the rest of their life, and teaches them how to manage them on a long-term, lifelong basis. Whereas CBT not only addresses the habit-forming behavior, but also takes it a step further and tries to replace the habit-forming behaviors that are dysfunctional with habit-forming behaviors that are more functional. So both have showed some steady progress in helping people decrease the amount of chronic skin picking that they engage in, but it is very common for people to have chronic skin picking for the rest of their lives, lifelong. So that's why both therapies are considered, because both have been effective in helping to reduce the amount of time and the frequency of the chronic skin picking. Like I said before, elevated stress levels are very common with people who have been diagnosed with excoriation. So you want to monitor your stress. You want to engage in stress management skills. You want to be working personally identified coping techniques and relaxation techniques, such as listening to music, meditation, going for long walks, going to the gym and exercising, making a list, keeping a diary or a log of the amount of times that you're skin picking and for how long, reviewing that journal and log to see progress. All those different things are effective ways of coping with this particular illness, and you definitely want to engage in relaxation techniques and positive coping skills to try and counteract this, because it can be very, very time consuming, and it can severely interfere with your functioning, especially when it comes to like a job. There are people who end up, calling out sick because they can't get away from, they can't stop the skin picking. So all of a sudden they're like an hour late for work, 2 hours late for work, 3 hours late for work, and they're still skin picking. Eventually they just call out and say, screw it, it's not going to happen today. So, you just want to do things that are going to help to keep your stress levels down. So because the stress levels are correlated directly with the skin picking, and if you manage your stress well, you should be engaging in that skin picking behavior less. And that's pretty much it. That's all I have for today. Thank you so much for watching. If you have any comments, please leave them in the section below. And good day, everybody. Enjoy this weather. Enjoy the rest of the day. Bye.